COPD, it's chronic obstructive pulmonary disease, and it's a chronic inflammation of the lungs, and it can cause obstructive airflow, and symptoms can include breathing difficulties, coughing, excessive mucus, and you can produce a lot of wheezing. Some of the vitamins that can help. You've got vitamin E. Studies suggest that people who experience flare-ups of COPD, they tend to have lower levels of vitamin E than people whose COPD is stable. There's other studies, and they also suggest that long-term use of vitamin E may prevent COPD. For best results, you want to take a mixed tocopherol, and that's a combination of the different sources of vitamin E. The mixture contains alpha, beta, gamma, and delta tocopherols, and they're all natural forms of vitamin E. People with COPD can reduce some of the symptoms by taking regular doses of vitamin D. That's according to a new study published in the journal Thorax. In order to determine your dose, what you need to do is get a 25-hydroxy vitamin D blood test, and then you can supplement accordingly with vitamin D3. Vitamin K2 works synergistically with vitamin D3, and consumption of vitamin K is associated with reduced risk of developing emphysema. COPD, compromising of emphysema, and chronic bronchitis are the most common chronic respiratory diseases that impact a huge clinical burden. The maximum amount of K2 that your body can absorb in a day is 300 micrograms, so doses any higher than this aren't needed. Vitamin A deficiency promotes and it aggravates pre-existing inflammation. Some previous studies have demonstrated that the risk of COPD increases with decreasing levels of serum vitamin A. In addition to the importance of this vitamin for lung function, vitamin A is also responsible for the development of many tissues and cells, as well as for the embryonic lung development. Vitamin C has symptom-relieving effects on the exacerbation of COPD. And in addition, it improves pulmonary function in COPD. And moreover, a recent animal study showed that supplementing with vitamin C not only prevents the development of COPD, but it also helps restore the lung function in COPD subjects. The best form of vitamin C is liposomal vitamin C. Then the next best form is non-acidic buffered vitamin C. And the worst kind is a cheap, acidic ascorbic acid. Bioflavonoids possess both antioxidant and anti-inflammatory properties, and hence they may influence chronic inflammation diseases like COPD. Oxidative stress is an important feature in the pathogenesis of COPD, so targeting oxidative stress with antioxidants or boosting the endogenous levels of antioxidants is likely to be beneficial in the treatment of COPD. Bioflavonoids help to improve the action of vitamin C, therefore they make a good combination. One popular flavonoid is quercetin, and in a preclinical model of COPD, quercetin reduced markers of both oxidative stress and lung inflammation, and it also reduced rhinovirus-induced progression of lung disease. Vitamin B12 deficiency is a real problem in COPD populations. So you want to take B12 in the form of a sublingual methylcobalamin under the tongue for best results, and that's if vitamin B12 injections aren't available to you. Note that the B12 blood test can fail to detect a B12 deficiency due to food now being fortified with folate, and this folate in the body can then throw off the test results. Allicin, found in garlic. The anti-inflammatory and antioxidant properties of garlic are beneficial to people with lung conditions like asthma and bronchitis. and a recent study even showed that garlic has a protective effect on lung cancer patients, even to the extent that it might work as a chemopreventive agent. It may also kill any bacterial infection that could occur when someone is suffering from COPD. Coenzyme Q10. The body naturally produces coenzyme Q10, an antioxidant that's been studied for its potential role in battling cardiovascular conditions and even cancer. It's available as a supplement, and CoQ10 may even have merit as a natural remedy for COPD by helping to increase cell activity and to ease inflammation. In trials, doses of 300 milligrams to 500 milligrams per day were needed in order to see results. Usually, the best form is ubiquinol. PQQ. Coenzyme Q10 works synergistically with PQQ, and a typical PQQ dose is 40 milligrams per day. PQQ is a bacterially synthesized quinine, and it's a strong redox cofactor with multiple biological benefits, including antioxidation, anti-cancer, anti-inflammation, the modulation of the mitochondrial metabolism, and neuroprotection. As both PQQ and CoQ10 work on improving the mitochondria, you can see my other video on mitochondria boosters for more information and more options. Omega-3 fatty acids may reduce bacterial lung infections associated with COPD. Compounds derived from omega-3 fatty acids, like those found in salmon, might be the key to helping the body combat lung infections, and this is according to research at the University of Rochester School of Medicine and Dentistry. Researchers found that higher omega-3 intake was associated with fewer severe COPD exacerbations, better symptom control as indicated by validated patient response measures, and a trend towards higher lung function. Typical doses of an omega-3 EPA DHA fish oil blend can be 3 to 9 grams per day. The cordyceps mushroom, Cordyceps sinensis. It's a complementary medicine used for chronic obstructive pulmonary disease. It's known to improve athletic performance by increasing the oxygen in your blood and making it easier to breathe. Researchers at a University of Chinese Medicine conducted a review on 15 high-quality studies that involved 1,238 COPD patients, and they found that cordyceps significantly improved lung function, exercise endurance, and quality of life, with no report of any serious adverse effects. Another herb which can have similar benefits to cordyceps is haritaki. It's one of the most popular herbs in Ayurveda, as it's said to balance the 3 doshas, Vata, Pitta, and Kapha. It's renowned for its ability to be able to increase blood oxygen by up to 300%. Some research shows that taking echinacea along with other supplements like zinc, selenium, and vitamin C may ease cold symptoms. That in turn may help with flare-ups. The combination of echinacea, zinc, selenium, and vitamin C may alleviate exacerbation symptoms caused by upper respiratory tract infections in COPD. Further studies are warranted to investigate the interactions among echinacea, zinc, selenium, and vitamin C. However, it may be worth a try. You can take 50 milligrams of zinc picolinate per day, and you could eat 3 Brazil nuts to get your required amount of selenium. Inula helenium, or elecampane root. It's a herb that's used as a dietary supplement for various health conditions. It's native to Europe, where it has a long history of use, and it's also used in traditional Chinese medicine. Elecampane root contains active compounds with anti-inflammatory properties, which may help treat inflammation related to respiratory diseases. One review of over 120 studies suggested that elecampane has antioxidant activity, and that may help fight oxidative stress and inflammatory diseases, including cancer, impaired brain function, and diabetes. Elecampane root has a long history of use in the reduction of cough and respiratory-related conditions like rhinitis, bronchitis, and throat infections, particularly in folk medicine. One test tube study found that analactone, which was isolated from elecampane, suppressed airway inflammation resulting from cigarette smoke exposure, as well as helped open airways. The authors even suggested that the analactone was a potential therapy in COPD, a chronic inflammatory lung disease that often results from smoking and can make it difficult to breathe. Test tube results also have observed that elecampane can slow white blood cell activity and reduce inflammation in the respiratory conditions. Products that are currently available suggest taking between half a gram to 1 gram of elecampane root per day. This can be boiled and then drunk as a tea. Curcumin from turmeric. The growing amount of data from pharmacological and animal studies support the notion that curcumin plays a protective role in COPD, acute lung injury, acute respiratory distress syndrome, and allergic asthma. Doses can range from 2 grams up to a maximum of 5 grams per day. Due to its low bioavailability, its absorption can be increased with biopterin, which is a black pepper extract, or by consuming it with a fat such as butter, ghee, coconut oil, or fish oil. Probiotics may be useful in COPD patients, particularly those with frequent viral infections. Of interest, a diet supplemented with Lactobacillus plantarum prevents cardiovascular disease in smokers. Golden seal. Berberine is considered to be an active constituent in golden seal, a popular herb for the immune system. Berberine effectively alleviated lung injury by reducing lung edema and neutrophil infiltration. Berberine also significantly reduced histopathological inflammatory changes via inhibition of endoplasmic reticulum stress and activation of the NRF2 pathway signaling. In trials for blood sugar, 500 milligrams of berberine hydrochloride was taken 3 times per day. This may also have life-extending possibilities, as you can see from my other videos on life extension and one on the anabolic triad. A traditional lung tonic contains the 2 herbs ivy and thyme. A German study found that the unique mixture of essential oils in thyme helps to improve the clearance of mucus from the airways in animals. It may also help the airways to relax, improving airflow in the lungs. Whether this translates to real relief from the inflammation and airway constriction of COPD remains less clear, but it may be worth a try. In a study, glutathione levels were shown to increase in stable COPD patients and healthy smokers, and it was shown to decrease during the severe and very severe exacerbation periods. Sputum glutathione levels were high in COPD patients in the study too. So ways to increase glutathione are by taking reduced glutathione at up to 1,000 milligrams per day, by taking N-acetylcysteine at 500 milligrams 3 times per day, which is renowned for its respiratory benefits also. You can also use the herb milk thistle and ensure that you get your daily selenium, which is required for your body to synthesize glutathione. There's many differing recommendations for diet for COPD. Some suggestions, though, are to eat 20 to 30 grams of fiber per day from items like bread, pasta, nuts, seeds, fruit, and vegetables. Eat a good source of protein at least twice a day to help maintain strong respiratory muscles. Good choices of protein could be eggs, meat, fish, poultry, nut, dried beans and peas. You want to try to avoid dairy, as this may create excessive mucus and make it harder to breathe. Sleep troubles can be common in those who suffer from COPD, and people who have a hard time breathing at night due to COPD may wake up frequently and have trouble falling asleep or staying asleep. Overall reduced sleep time and sleep quality may also occur. This can increase risk of many complications and other diseases. So you should check out my other video on herbs to help you sleep for more information on this. Finally, the enzyme serrapeptase digests mucus from within, reducing the amount of mucus in the lungs without the sufferer needing to continually bring it up. It's a common favourite for chesty coughs and blocked sinuses. It's also recommended for its long-term use to sufferers of COPD.